We are a primary care clinic that often works in conjunction with the Multicultural Center and the International Institute of Erie. As such, we see a lot of patients for whom English is a second language, and we take pride in the fact that our staff is multilingual and multicultural to be able to care for these patients on a truly individual basis that other clinics can't provide. Well, from the start, our practice has stressed that interdisciplinary care and communication reduces medical costs and maximizes patient outcomes. For us, that means our physicians and our pharmacists are collaborating for the benefit of our patients' health. We just instituted a new MTM, or Medication Therapy Management System, which shifts the burden of maintenance therapy onto the pharmacist. That frees up our physicians to focus on diagnosis and the coordination of care.
Our pharmacists rotate between outpatient pharmacy and clinical. In the clinical side, we follow up physician consult with medications and therapy counseling. We review patient charts to make sure that the therapy they're on is appropriate with their other medications and medical history. We also make sure that the therapy design is appropriate to them and that they understand the significance of compliance. Pharmacists nowadays are especially trained in disease state management, and our expertise in medication makes this position logical. Well, Multicare pharmacists always had that clinical role. With MTM, we have an official avenue and reimbursement structure to make these services more available to our patients. Health literacy is a big problem among our patients. Now we can spend more time answering their questions, listening to their concerns, and better manage their health. With more time, our patients are going to be better educated and are going to be at less risk for adverse reactions and non-compliance. When pharmacists receive provider statuses, we could expand our role further to fill the growing gap in primary care.
The outpatient pharmacy is the last stop for most of our patients. It's the final checkpoint for drug interactions, questions, or misunderstandings. The medication literature is translated into any language that the patient prefers. We are also a part of the clinic that they see the most. It is our goal to make sure that our patients understand their therapy regimen, know how to use their medical devices, and have a place to call if they need any help. Having an in-house pharmacy makes it easier to directly communicate with the physician and make any necessary changes. With MTM, our system is better integrated between the primary care and pharmacy sides. Sometimes a patient just needs a brief evaluation to continue their therapy. With MTM, the pharmacist provides that consult here. Everything is documented in their profile so the physician can oversee their care without micromanaging every refill and change in blood sugar.
Our patients are of all ages, from pediatrics to geriatrics. Many of them do not speak English and know very little about medicine. Some of them have a completely different concept of what typical Western medicine is. In order to provide them with the best treatment, we look at the entire person as a whole. We look at their experiences, their knowledge, hopes, and fears. By understanding them and their cultural background, we're able to provide them with the best care possible in a friendly and comfortable environment. Our staff is diverse and multilingual. Our goal is to make the patient feel like they're at home. We want them to feel like they never actually left their country. And in order to do this, we take as much time as they need to understand everything, to understand the procedure that they're going through. And the service is provided in their own language if necessary.
We contract with Medicaid to direct these patients to our clinic. Our individualized care and the extra time that we spend with our patients helps avoid insurance inaccuracies and treatment errors. This reduces the financial burden to the state due to any mistakes or any duplications or non-compliance. We also contract with the main employers in the area, such as GE, the school districts, any governments, and universities, hotels, and even local branches of store chains. And we are always looking to initiate new contracts. By making these contracts, we negotiate directly with the company for reimbursement to provide our MTM services to their employees at a moderate fee. With the pharmacist managing patient care, our physicians are able to provide care to a larger number of patients daily. Many of our patients come to us without any insurance, so for them we have come up with a monthly cash payment system that enables them to receive the benefit of medical care. Having an in-house pharmacy means that we have better control over the cash prices for common medications. and the pharmacists are often changing therapies to more cost-beneficial ones. We also have social service contacts that sometimes help patients financially. So we always try to do our best not to turn any of our patients in need.
What we are doing is just the first step into what we hope will become a patient-centered medical home, a place in which patients have a personalized physician who coordinates their specific care amongst an interdisciplinary team. The patient feels respected and understood and has ease of access to care with any of their medical personnel. And those personnel are communicating amongst themselves about that patient's specific treatment. We welcome and encourage any new patients or referrals who wish to come to our facility and experience what we have to offer.